Now, up next is panel discussion 3, titled Future of Aging and Care. Leading this important discussion is Mr. Stephen Johnston, Fellow, Healthy Longevity at Simple Digital Lab, Inc. Joining us on the panel are Mr. Vic Keshup, Founder and CEO of Toy Labs, Mr. Mel Barsky, Partner, Center for Aging and Brain Health Innovation Ventures, Ms. Yasuko Akutsu, Associate Professor, Chiba University Hospital, and Ms. Esther Talbunkamp, COO Cure, Zyderland. Now, Mr. Johnston, the floor is yours.
Thank you very much. Great to be here. Thank you again to Sasaki-san and the whole of the METI and the JETRO team. My name is Stephen Johnston. I'm delighted to be here moderating for extremely well-versed, intellectually curious and smart and international experts on this topic of a very small, very easy to resolve topic. What is the future of aging in care? A little bit of background from me in terms of Japan connection is that I've been here a few times, really starting from probably 2014, 2015, when Yasuko, who was our first ambassador in Japan at Aging 2.0, the organization I ran previously, invited us to come and have a connection, have some pitch events and startups. And ever since then, I've been impressed with the capabilities, the expertise in Japan. And one of the things around aging, one of the things that I am so interested in are these kinds of events that can be a bridge between the expertise and the insights and the how do they do it, that the rest of the world is increasingly answering and asking these questions. And we have many answers, I think, in this room. In terms of framing the topic, one of the things that I think is helpful as we think about the future of any topic, really, is sort of looking at the scenarios. And we don't really know what's going to happen next week, let alone in the next 10 years or 20 or 30 years. And so one of the things that I think we should think about is what are those uncertainties that could really determine the fate of where things go? And I think a couple of things that really struck out for me in terms of framing the topic is one, the level of inequality in aging. And what we're seeing is there's a potential for all these new technologies, all this new AI, all these new impressive biohacking that you're seeing from folks around the world to kind of almost create a superclass where we have people who don't really think about aging and care at all because they don't need it, because they are superheroes. I was going to say supermen, and I think that's a bit sexist, but frankly, most of them, the biohackers are men. And so I think one of the challenges and one of the contexts that we're sitting in here is thinking about how do we build a future that doesn't have an inbuilt inequality that is just escalating. We're seeing escalating inequality in income, and we're seeing areas, for example, in the US, but also in the UK and other Western countries where we're seeing 20 or 30-year lifespan and health span gaps between different parts of the same town. So I think that's one of the questions that is I'd like to sort of explore and dig into a little bit in the context of the discussion. Then the other thing is around data and around tech and data. And one of the big drivers is who is going to own the data that is going to power these AI models that are going to support us and help us live better lives and have successful aging and care. We heard that in the earlier session come up quite a bit about who is going to drive and where do these data models come from. And I think one of the things that we're seeing is an increasing realization and understanding that the data is increasingly valuable, but it's also increasingly something that consumers and end users and individuals are going to be asking questions about. And as we look at the innovations, I think we should be asking who is owning the data and how are we using the data to improve the lives of older people. And it's not necessarily the quote that I heard and I loved, which was we can think about AI as benefiting 8 billion people and not just 8 billionaires. I think there's a couple of those framing topics that allow us to go in many different directions. So I think, obviously, I'm not picking a specific solution, but how we decide on those trends is going to be important. So with enough of the context and the sort of the agenda setting, I want to turn over to the expert panelists and really start to hear from them. I'll do sort of quick intros first, and then we'll get going. So Dr. Esther Telpenkamp is representing the Netherlands and has a very rich background. I think you have a PhD, an MD, and an MBA. So was there any certification that you don't have? This is a very well-informed and well-versed operator who now running a COO, was one of the biggest healthcare groups in the Netherlands. They have nursing homes, they have hospitals and retirement groups, and so it was really living and breathing and building out. I think you have a PhD in how to implement e-health, so really hands-on expertise in how to build systems and sort of make them work. Yasuko, I mentioned before, is really the reason I'm here. Big debt of gratitude, and I think many of us in this audience owe the same debt of gratitude to what Yasuko has done as an innovation activist, building the ecosystem, and has been really got a deep expertise, master's in environmental design, which I didn't realize until I was reviewing your bio today, which I think is really setting up for a lot of the topics that are going to emerge in terms of how place can inform aging. Studying for PhD at Chiba, where you're also an assistant professor there, and has really been, I'd say, a connector as the Aging 2 ambassador, I think from 2012, 2013. So over a decade of at least selfless. I know the salary for Aging 2 ambassadors, and it's zero. So it's a pro bono position, but the value that she's providing, and hopefully the value is getting, is significant. Mel Barsky, who's I'd say probably one of the most connected Canadians, especially when it comes to aging and health. And happily for the Canadians, he's also one of the most deep-pocketed. He's got a pool of, he's spent about 200 million of the Canadian money, if that's right, and about 500 projects over the last few years at the Canadian, at the CABI, the Centre of Aging, Brain Health Innovation, supporting large number of projects. And I think really the US and other countries can look to Canada when it comes to ecosystem building and funding and supporting innovation. And you also have an Australian sheepdog, I think. So I think there's a connection with my current home country of Australia. So thanks for being here, Mel. And Vic has been another friend and colleague, I think for many years, probably approaching a decade. Vic is one of those entrepreneurs who has been through it and has just, I'd say, the perfect entrepreneur is that he's got a vision and he just sticks to it, despite whatever happens. And I think I remember it's probably about 2015, 2014, one of the first pitches in very early days. He's built this company, Toy Labs, smart toilets, partners with Toto and other big brands who believe in him, is now building, it's actually coming to life. But this was early days, and this was really at a time where the concept was completely novel. There was a whole bunch of new biomedical diagnostics, and this was does this fit? Who's going to pay for it? But he stuck to his guns. I mean, he's a VC background. He's had time living in Japan, so he knows how to work the system, and he can really talk to us about actually how to sort of build and succeed in making products that commercialize in the space. So thank you all panelists. I want to open it back and go back to Esther to really explore this topic. And one of the mantras that we used to talk about at Aging 2.0 was the future is here. It's just unevenly distributed. So just take it a bit more granular and let's think about, okay, if we hear from some of our panelists from around the world, what are some of the things that they're seeing that are representing sort of the future emergent trends, either positive or negative stresses, and sort of give us an example, a couple of examples from each of you. So if I turn to Esther, please share some thoughts from the Netherlands.
Well, thank you very much for the kind introduction. Well, when I'm looking from the perspective of my current job, working in the board of a large healthcare institution, what we see is that we just cannot cope anymore. We have a huge shortage in personnel, and it's getting worse and worse every day. So I'm here now in Japan. I'm getting WhatsApps from my directors every day, because then there's another problem again in the emergency care, or we're in a nursing home. So when you think about healthcare organized from institutions, I think we need to transform very disruptively because we just cannot organize it anymore like we did before. So that means probably several things. First, we'll have to think about redesigning healthcare. For whom are we organizing healthcare? For whom can't we organize it anymore? And when we're going to redesign healthcare, we also have to think about how can we support communities? How can we support community care? Especially GPs, but also non-professional communities should really step in when you think about the aging population. And we need to support those communities with our healthcare organizations, but also with digital solutions, with tech solutions. So digital solutions and AI should also equip patients, should equip families to really take care of their family, for instance. For instance, my father has dementia and he lives with my mother, and he can live with my mother because me, myself, and my sister are taking care of him with our children. And also because our GP has a very good digital patient portal where I can check his medication, where I can check his lab results, and I can chat with the GP and with the elderly care nurse to ask questions, and she responds really quickly. So it's not about technology, it's not about digitization, it's never is. It's about the human beings and how can we support them.
To clarify, that was an AI nurse or a real nurse that you were
A
chatting
real
with?
nurse.
And you can get a real nurse on the phone really quickly?
Digital.
Or chat, as a chat.
Yeah. No, not by phone. No, it's a chat. So, yeah. So that's for a start.
Yeah, great. Thank you. Fantastic. Thank you. So let's go to Vic next. Tell us a bit about the future that you're seeing and how you're sort of starting to, basically the journey that you've been on and how you see the key trends affecting your business and how they could affect the broader aging and care ecosystem.
Absolutely. Thank you, Stephen. Thank you, konnichiwa, minasan. It's great to be here today. So a little bit about maybe the motivation for why I started Toy Labs. So I have the same condition that Shinzo Abe-san has, Kaiosei Daichuan. And I developed essentially a new treatment for the condition. And that's how I got interested in building sort of a toilet technology in the future. And so, I have a very personal kind of story behind what I've invented and now we brought to market. And, I think my perspective on this, to answer your question, Stephen, is that, to bring any new product into market is challenging, but to do it in age tech is particularly challenging. It's not to say that it's not worthwhile, and I've been on this journey, as you mentioned, for some time now. We have taken a product that has never been created before. We brought it into market in the United States. We have over 50 senior care facilities using it. Toto invested in our company. We've launched now the product in Japan. And so, I can speak to a lot of the things that we've learned in being able to take something that's very new and then actually bring it into use. And I think, some of the key things, touching on what Esther said, is that you have to be able to solve real problems. And I think what we hear across the board is that the biggest problem is a care shortage. There is just not enough supply in the industrialized world to care for the people who are getting older. So whatever technology you build has to be able to have a multiplier effect on human time. And the second thing, and this was brought up in a previous panel, is around integrating into the workflows. So if you can't build a technology that doesn't require someone to change their behavior, doesn't require additional input by the care staff or additional effort, that's going to be really critical. And then the third, of course, is figuring out how to fit into the payment system. And each country is very unique. My country, the United States, has a notorious healthcare system. The highest amount spent per capita yet some of the worst healthcare outcomes. And so, you know, and it's a completely sort of free market system in a sense compared to Japan's. And so, you know, I think that there's a lot of different things to unpack there, but at a high level, you know, those are sort of the three large areas that I think any person or company that's trying to make an impact is going to have to confront.
And just one more on that, in terms of the sort of the headwinds or tailwinds, you know, it's a very uncertain environment right now in the US, but some people have been saying that actually makes it an easier environment for innovation and for outliers and for new thinking. The redesigning healthcare, blowing up healthcare that Esther mentioned. How are you finding it as an entrepreneur? Do you find a tailwind or a headwind?
Well, you know, the US has the largest healthcare system in the world by far. But it's also one of the most corrupt systems, quite frankly, and it's a very sick sort of society that we have. And if you look at the food system, if you look at the entrenched players from pharmaceutical companies to the insurance companies, you know, to different types of groups that have their own interests and make money. There's a lot of challenges, but on the other hand, the United States is an extremely dynamic place where there's a lot of entrepreneurialism, there's a lot of capital, and there's a lot of, you know, you can even see it with the current administration. There's a lot of openness to challenging the status quo. And so I think the US is in a very unique position in those senses, but I think that a place like Japan, which has a tremendous amount to offer to the world in terms of the contributions to its understanding about how people can age and the practices around aging better. When you look at the government and how it is involved in long-term care insurance, for example, everyone over the age of 40 has to contribute into the LTCI. There's just, I think, a lot to learn in Japan and a lot of opportunities here, frankly.
Yeah, the long-term care insurance system, if you actually look at it and understand how much it benefits people, as an American, it's probably quite surprising and shocking to see that you can have this thing that you're paying in from 40. It gives you pretty much universal coverage from 65, and it's very cheap, and it's like $30 a month, and it's remarkable. So there's a lot here that we can learn from. Thank you, Vic. So Mel, a couple of things that you've been doing that I'm really excited about to hear that I think represent some of the future of aging and care, some of the innovation projects that you maybe can just give us a couple of the flavors that you are most excited about, that you think perhaps represent a new era or new models for us to look at. But also, which I think is often neglected in this excitement about tech and innovation, is the people who actually matter most, which is the individuals at the edges. And you've really lent into this concept of building networks of informed participants, building this global deep network. So whether you want to start with the tech side or the lower tech side, give us a couple of things that you're seeing that are emergent topics.
Great, thank you, Stephen. Thank you for inviting me here, everyone. And first, I wanted to mention of the other countries that Vic has installed Toy Labs, it's also been installed at our parent organization, Bakecrest in Canada. So thank you, Vic. In talking about some of our models of how we work at the Center for Aging and Brain Health Innovation, the acronym is CABI. When we look at, we're an accelerator program and a venture arm of Canadian government and also some private money. When we fund these programs, we design them with acceleration services in mind. How do we bring the best services to help these new innovations, to validate that the technology works. So we're closely with our researchers at the Rotman Research Institute affiliated with the University of Toronto, and we help them to scale and grow and get to market. Every company that we bring in to look at, we've always run them by a seniors advisory panel. And that's a local group of older adults, but effectively because we're focused on the aging and brain health sector, they're the end users, and you should really have the voice of the end user speak to the innovators and the entrepreneurs as they're developing a solution as to say whether they would like to use it, whether it's easy to use. As Vic said, if it's something that's very passively there, it's easy to use. It's not difficult. It just happens. That's the best way for it to work. So we get our seniors advisory panel to give input on the companies that we work with. And that's sort of a homogenous group because it's local, Toronto-based, and a few older adults and urban. And we decided, how can we get the voice of the end user everywhere, globally, with diversity of culture and language and geography and other things, to have a voice in this? So you can truly give an innovator the information they need to scale and grow their solution to a global market. So we created something called LEAP, which we said won't stand for Lived Experience Advisory Panel, but I like that acronym actually works. So our LEAP program, we have tens of thousands of people who go online and can review and talk about and give feedback, end user feedback to the innovators on different solutions that we bring to them. And it's done in a global way, and it's done in a curated way. So we put our portfolio companies have the opportunity to use it. And other big industry companies, whether it be insurance or other kinds of companies, may say, we have a solution, we'd love to validate it, and you've got this perfect ecosystem set up to try it out in. So the LEAP network is one of those examples that I think you're talking about and kind of impressed about. And it kind of ties into what you created before with Aging 2.0 in Yasuko. I think that's where I first met you, Stephen, was about 8 years ago at an Aging 2.0 conference. And it's the same concept of getting a global community to work together. You're getting innovators to talk to each other, and this is a way to get innovators to talk to end users and older adults. So we have a series of programs that look at different push mechanisms and pull mechanisms of how we can review what innovators are creating, and we'll do a call for innovation under different programs, and they come to us and say, we're looking for funding and this is what we're trying to do, and we'll fund those top ones that look like they'll make a difference. And then there's kind of the pull methodology where we'll go out, and we have a program called Discover and Adopt, for example, where we'll go to senior living institutes across the country and say, what's your biggest pain point? And they'll let us know, and then we try to match them up with companies either in our portfolio or not even in our portfolio, to finding the best solution, match them up with that institution. And it gets back to sort of what Esther was talking about, is that, you know, companies don't always have, they're fully tapped out, and it's hard to try out new things and new ways of doing healthcare. So we've tried to create a way where we'll fund you to try out a new innovation, and if it works, if there's positive health outcomes, and if there's a positive ROI, it should be a no-brainer to continue it. So it's kind of a few examples of things we're trying to do at CABI.
Just, I wouldn't mind a couple of thoughts on how you decide on what to focus on, because I think one of the things that's going to be important as we decide which the trajectory is going to be for the aging and care industry is those organizations like yourself that are very pivotal, and I'd say I see you really as an influencer, as a catalyst, but also a driver. It's going to be a big question on what are the objectives. If you just, obviously you've got a commercial partnership, you've got the government providing some funding, you've got a not lived experience advisory panel, but it does feel like that's a really good name for it. You've got a bunch of individuals. You've got the feedback from the senior care organizations, and so you could have 5 or 6 different competing agendas. Does the money always win out, or how do you end up deciding your innovation agenda?
Yeah, interesting question. This is a very good question. Few different models of how we work this out. We're involved in policy making. We've helped Canada design its first dementia strategy. So at a government level, we're trying to help shape policy to say, what's the direction, where do we need to get to? Because we're looking at leading countries and super aging countries like Japan, and Canada's following suit very quickly. So where do we need to be to take care of our population? And then we've designed a series of programs that I mentioned, some push, some pull. And some are very early stage research programs. So it's a call for innovation where there's a bit of a shotgun approach, because we're funding a lot of these kinds of programs. And it's grant-like funding, kind of like the NIA or NIH in the States. So it's not meant to be money wins out. It's meant to let's seed some of the best researchers and innovators in the market and see what kind of things they're developing on who we fund. So they present, and there has to be the proposal that this is something interesting and is focused on one of our themes or thematic areas that we're interested in. So cognitive brain health, mental health, aging in place, aging at home, caregiver support, care navigation tools. We've very recently introduced fintech solutions to say, how do we prevent older adults from having have scam issues or things like that. And then we're also looking at femtech and women's health solutions. So we're looking at thematic areas, and we'll put that out there, say, come to us with those best solutions. And then conversely, as I mentioned, with the DNA program, we're saying, what are your biggest pain points, and how can we marry up with the best innovator? In our programs, we cover what we call the complete innovation life cycle. So those researchers will do grant-like funding for early stage programs. The later stage programs, it's equity-like funding, it's venture funding. And there we are looking at those companies that will be able to hopefully make a big difference from a health perspective, but also will be an economic home run also. And we're taking equity in those investments, and that's been going very well.
Thanks, Mel. A lot on your radar, and yeah, it's exciting how that all comes together and starts to show tangible, measurable output. Excellent. So Yasuko is going to do something slightly different for us and share a slide. And one of the two of the key trends that inevitably just going to be rising as we think about the future of aging in care is dementia. The numbers don't lie. One of the few conditions that really hasn't had a lot of success when it comes to biotech innovation. One hopes that is going to change with these new AI models, but that's just a continuing growing burden for countries around the world. And so some really interesting innovations that Yasuko was going to highlight, but also social isolation, social inclusion, such a trend. I think we're seeing that globally, accelerated by sort of our tech obsession or tech disintermediation from reality. And there's a couple of really quite practical examples that Yasuko is going to walk us through. So over to you, Yasuko.
Thank you. So, first, in Japan, universal coverage is very excellent compared to other countries. So yes, everything in Japanese industry thinks designing a products mostly care technology. And so they expect that all of them are covered universal coverage. But unfortunately, it is not continued. We have to, so it's a pessimistic, but optimistically, we think we have another good market. We have the aging market. So that aging 2.0 changed my mind, because I always think about aging technology is just care technology. But now we have to think about aging market. So consumer markets, because 60% of the Japanese stock is owned by over 60. So there is some potential for consumer market. But there is a big barrier. It's data difference. It's a data divide for all that, and include me. So we have to use the technology by myself to live independently. So, and I introduced my study about. I introduced today in study, and so I learned from Kavi is how to developing a technology or that because including all the adults. So you have the good way, and I will introduce to Japan from now on. And so in Chiba University this spring we start a living lab. It's so testing field for technology, and so including industries and academias and government and all the citizens and all ages. And we will start testing, but we don't know how to do that. So we have to learn from other countries. And so now we are focused our research on our robotics and generative AI, how acceptance all the adults and how influence as all the adults. And so I have now a unique case I introduced its robot home. It's launched 9 years ago, and so it's 10,000 units already sold, and so user is old women from 50 and 60 and 17 or oldest is 19. And so that's really unique. So they think it is the chart, and so dress it. There are dress, and they have the dress it and name their each robot homes, and some making networks, and so they using share the photo to Instagram, and they said they if they met robot homes, they didn't use Instagram. So it's a very unique cases. Do you know kawaii? Kawaii is a concept of the cute, and kawaii is engaged. Yes, emotional engagement. It's a Japanese unique point. And so it's a kawaii concept is makes all the adults to the closer technologies. And yes, and so in Japan is you know Astro Boy and Doraemon that we grown up with them, and so it's I'm 60s, and so I'm 60s is Astro Boy's generation. So it's a kawaii products. It's make us close to the technology. It's important to emotional behavior is near the close to the technology. And so I know that LEQ you said, maybe Japanese people don't like the LEQ. I love but their loves it like a kid. It's that's interesting.
Margaret Robert LEQ you're talking about that you're referencing?
Yes, LEQ want to enter the Japanese, and so I asked some.
Japanese don't like it.
We don't have no.
It hasn't been successful. Has it been successful yet
Yes.
in Japan?
Yes,
Has
please.
it entered?
In Japan, I think the folks from LAQ are actually here in Japan and maybe at Expo, I believe, this week. And I think they have,
I see.
huh?
I,
Yeah, I think they have just translated it to Japanese.
oh, really?
Yeah.
But I love LQ, but so it's important to wearing some clothes. And so they want to, robots, it's like the kids. It's a key point.
Move your microphone a bit closer.
Yeah.
Use your microphone a bit closer to your mouth. Yeah, so we can hear you.
Oh, okay, thank you. It's any kids don't wearing a dress, so sometimes Japanese or the women loves we are like a kids, and so wearing and so give a name, and so they take everything. That's a Japanese unique point. And and another initiative I will introduce is Orange Innovation Project. It's a project is supported METI. It's an Orange Innovation Project is a platform to make the product with people with dementia. It's last year it's the role of dementia started. And so one of the initiative of the law. And so I think so it is important, we are scared is dementia, but it is important to live in communities after the diagnosis. So there are a lot of big company join the project, and they make many products. So we want to. It's a good case with collaborate with another countries. That's all.
Great, thank you. Thank you. So lots going on, as I would expect. Maybe, Esther, from your perspective, tell us a bit more about Holland and the context there, because one of my, I guess, propositions is that inequality is a big deal in aging. And maybe it's not the case in the Netherlands, because you have a famously egalitarian culture, you have a very supportive state. Kind of wanted to get your sense of whether this concept of inequality sort of resonates with you. Is that something that you're seeing? And then also sort of understand more what we've just been hearing about the participation levels. Are you seeing the participation of the end users in some of the work that you're doing and sort of really bringing them in as co-designers and collaborators, or is it still a bit of a sort of, we're the smart patients and doctors and you guys, take what we give you?
Thank you for your question. Let me start with the first one about the inequalities. It's a huge problem in the Netherlands, and it's a much bigger problem than in Japan, the inequalities. So it means that the most important factor that influences your health in the Netherlands is the region where you were born. And if you're born in an underprivileged neighborhood, it affects your health for the rest of your life. And you just cannot do anything about that. And the difference in age between privileged people in the Netherlands and underprivileged people is around 10 years of life expectancy. So that is huge. And it's not only about life expectancy, but it's especially about quality of life. So the quality of life for aging people who are underprivileged is much worse than for privileged people. And we have not been able yet to build a bridge between those two populations, actually. So that is a huge problem. And also when you think about co-creation or participation, that also is a big problem. Because it's quite easy to let intelligent, empowered people engage in all kind of pilots and projects and let them think about healthcare of the future or digital health of the future. But it's extremely difficult to co-create with people who actually need it the most. There are several programs in the Netherlands to engage the people who need it the most. For instance, we have had a very successful program in the south of the Netherlands where we have our healthcare organization, where we really invested for over a year to have citizen panels every night a week. And we asked them, what kind of healthcare do you want in future? What is important for you? So not the arrogant doctor or nurse who's telling you what to do, but we ask them what they need. And actually it was very interesting because, for instance, we talked with them about a concept that was actually developed by citizens themselves, which we call the social hospital. Citizens in our region asked us to make a social hospital, which means that when they're in a normal hospital and they have a question about their health, for instance, they have diabetes or cardiovascular disease, they wanted to have a facility in the hospital where they can ask questions about them being lonely or about their debts. And they really want it in one place. And from our perspective, being in the board of a hospital, we thought that's not our job. That's something for the municipality or is something for the GP, but not for us. But they asked us to engage on that part. So that means that right now we are co-developing with citizens, with municipality, with government, this social hospital concept. So you can be really surprised if you really let citizens, patients, and other professionals engage in your plans, thinking about healthcare of the future. So I'm really happy to hear from Mel and Yasuku the same experiences in their countries. Actually, it makes my job much more fun. It's always nice to be surprised, isn't it?
Yeah, thank you. I think there's a really definite trend here around recognizing and capturing the voice of the end user and integrating that into our systems. And some really interesting innovations that we've been seeing. There's one in Stanford recently where they had this experiment to say, hey, could we do consumer research more effectively than having those pesky humans with flesh and bones? Let's make digital twins. And they interviewed 1,000 regular people from across the spectrum of different demographics and representative perspectives, 2 hours. And then 2 weeks later, those same people were asked 40 questions or so. And then the digital twins that had been created from that 2-hour conversation was asked 40 questions. And again, in two weeks later after that, from all types of questions. And the digital twins answered basically about 80 to 90% of the same ways that the humans were answering. And so if you think about this, was initially as a thought exercise, research for consumer research, but you can imagine it also being useful for democracy, for product design, and pretty much any area, not outsourcing, but how much better and how much easier to be able to ask, at least get 80% right if you're not constantly engaging people and interrupting them all day, but to get their perspective. So I think there's a way that we can architect for participation. It doesn't necessarily have to be that. And the other thing that Vic's point about essentially super biohacker here reminded me of, there's a guy called John Breivik in the US who's just done a sort of self-experimentation. He was fed up with all of this microplastics discussion, and apparently there's a 1 plastic spoon worth of microplastics or plastic in our brains, on average, which is pretty alarming if we think about it. And so he did a self-experiment on himself, not wanting to die of sort of age-related plastic spoon diseases, and figured out, or had this hypothesis that sulforain, which is an extract from broccoli, was effective at essentially flushing out the microplastics. And that's what happened. He did a test for the next few days, and he found that he ate this high concentration of sulforain. So broccoli, I don't know if it was tons of broccoli or just the sulforain, and then his microplastics in his blood went up, and then they just disappeared. And there's sort of experiments like this that we're seeing that can be brokered by tech, brokered by these new sort of types of diagnostics at the edge, that I think has to be an emerging trend. Just sort of wondering, Vic, if you've seen other experiments, you've done this on yourself, do you see this as a trend that we're seeing going global?
I think one thing we all have to acknowledge is the power of computers right now in terms of the knowledge that they're able to, that a computer today using ChatGPT or Perplexity or another AI agent just has in terms of superiority over essentially the practice of medicine, which is not a science, it's an art. And in a world, on the front lines where there is not enough time that the medical profession is able to provide, there's not enough personalization and time to understand, who is being treated. And in a world which is rife with medical errors, okay, and that's definitely, you can say that is in most of the industrialized world. You have iatrogenic illness and death as being one of the leading causes of death. In the context of that, I just want to say, I think that people taking their health into their own hands and taking matters into their own hands makes a lot of sense. And I think that what we're seeing right now, this emergence, at least in the Western world, of this focus on how can we live longer, it's actually already been perfected in the East. The things that are already embedded into the culture here in Japan, hara hachibun me, eat until you're 80% full. Take a bath every day, ofuro, mainichi. These things are just like time-tested methods, fasting of extending life. And I think now with the power of what we can do with computers, with sensors, with interconnectivity, I think the power is coming and it's shifting into the hands of the patients. And I think the medical community, I think, is not, it's notoriously hidebound, but I don't think it understands quite the scale and the intensity of what's happening right now. And I do predict that healthcare is going to move to the home, and it's going to happen pretty quickly. I think that people are going to get tools in their own hands. They already have them today, which will outperform the existing delivery of medical systems. And it's going to be really, really interesting because it's going to allow highly knowledgeable, highly personalized, highly precise methods that just simply were never available before. And I can cite lots and lots of examples, including my own journey, which I could talk about, where the current system just isn't serving the patient effectively.
I presume, Mel, that you are both supporting, identifying that trend and supporting it with the activities and the projects that you're working on. And I guess my question is, assuming, one thing that we said to the panelists in a prep session we had is that we're not going to talk about the thing that everybody knows already in terms of the pyramids and aging in place is a big shift. But I do have a question, Mel, as to whether you think that the longevity economy that Yasuko was talking about, which we talk about in different ways, the age tech market, like, is that a thing? I mean, a lot of what we're seeing is essentially health tech, or it's retail tech, or it's mobility consumer services. Are we seeing in terms of the future a new emergent longevity tech, age tech market that is sort of consumer driven in the home and is separate from consumer market, health tech market, other markets exist? Is that a thesis that you're developing, and what's your opinion on whether age tech exists?
I think, Stephen, that like age tech is a term that we use. We can put titles, we can put terms around all these things. What's this area that we're focusing in? I think there's a couple things driving this. As we have this aging society and the problems that result with aging, the health ramifications, that there's more and more focus on it. The new terminology, we've been working on groups. We were speaking at the G7 conference last week, or a couple weeks ago, with folks around a gentleman named Dr. Harris Ayer, a term called the brain economy, just the overall brain economy. And if you think about it, that everything is pervasive to all kinds of industry, and everything we do is related to brain health. And with not just older adults with dementia, Alzheimer's, but everybody, if you've got mental health issues, how does that affect the workplace in every industry in the world? If you've got 40% of people that have some degree of stress, anxiety, mental health issues, and that lowers productivity, and that lowers GDP, and that lowers the bottom line of a corporation, how could we improve not just people's own health, but our overall economy? You can frame it and give it whatever kind of a term you want, but anything that's going to be helping overall health and not just longevity in terms of age span, but health span. If we're living better, if we're living longer, that's going to be the areas of focus that we're looking at. If you can utilize tools like AI, as Vic is talking about, and that allows you to do more tools at home to help manage your health, people are going to do that, especially when it's easy, and it is easy. When we have a supercomputer in the palm of our hands, and we can ask a chat GPT kind of a question, and learn about our health situation better than we ever could before. Like right at the beginning of the conversation, Stephen, you asked Esther, can you in the Netherlands get a hold of a nurse or a doctor right away? And you said you can by chat. That's fantastic. But as AI improves, we're soon going to be able to get a physician in seconds who can you can counsel with, do consulting with over your phone. It can be done now, and we're at the precipice of AI really taking off. I don't think you can trust everything in AI. If you're got advanced mental health disorder, you're not going to want to trust a computer tool quite yet. You still want to have that human interaction. As Vic said, it's an art form to be able to diagnose certain things. But we're getting there where we're going to get to the point where you can use a computer to talk to an avatar physician. And before they said Google Health is very dangerous, that there's always certain things you're not getting perfect information, but it's getting better and better. And when we talk about the future of aging, I think that's where we're going to see major interesting changes in the next few years.
Yeah, I think, and I love what Harris and you guys are talking about with the brain economy and this idea that we're sort of building a capital asset. I think it actually goes beyond brain. I think it is the health as a capital asset for policymakers, and one of the projects that we're kicking off in Australia is a 5x5 initiative, which is trying to address that, bring 5 years back of good health span for the Australians who now have second highest in the world of the gap of health span, 12 years of illness and disability at the end of life. but then connecting very directly to a 5% boost in GDP and do that in 5 years. And I think there's some really good work by Andrew Scott and David Sinclair on the economic value of a better aging ecosystem and health span being improved. And actually, I would give some credit to the US. I know, Vic, I completely agree with you in terms of it is a broken system, but it's also got some remarkable innovation when it comes to business model and incentives around some of the capitated payments. And I guess to Esther and Yasuko, are you seeing anything over there in the Netherlands or here that is exciting you in terms of how do we, as you said, Esther, redesign the system, funding models that, whether it's the PACE program or even the Medicare Advantage, you've got incentives for people to make savings and to keep savings. In the UK, you've got cities that start to control their own budgets, and so if they make efficiency savings in care, they can save it and invest in other areas. I'm not saying it's universal, but there are sort of pockets. It's such a big thing. We're not going to be able to survive on the current trajectory by just having more capital flowing after the same problem. So, Esther or Yasuko, anything that excites you about a sustainable business model emerging in your areas?
Yes,
Yeah.
so regarding me, myself,
Yeah.
I don't like to live in a nursing home because it's food, dinner time, and everything to decide. We cannot live freely. I want to eat anytime I want. I want to go take a bath anytime I want. So it is. I'm happy. So and we are faced on the shortage of the caregivers. So it is technology instead of the caregivers. Technology help me, and I want to stay at home with the technology. It's very, and so, and this morning,
Do you have to pay for that, or is somebody helping you do that?
yeah, I want to help me by technology, and in the morning, the news shows the woman her husband passed away 1 year ago, and she talked with AI. So so she is very satisfied AI talking. In the future, it's same data. So I'm very trusted the AI in the future.
Yeah, I think we're going to see it getting universal. But, Esther, anything that excites you about sort of sustainable business models coming out of Holland?
Yeah, sure. Yes. And it's good to end optimistic, isn't it? So, yeah. I've worked in the public health sector in Netherlands. I've worked in a commercial business, international commercial business, and I've worked in universities as an associate professor. And the most exciting business models, most exciting innovations happen when those three collaborate in a good way. There are still bridges to build. I can sense that universities, public health sector and commercial private sector think differently. But when they collaborate in a good way, they listen well to each other, then exciting things happen. So for instance, in our own healthcare organization, we monitor right now 10,000 patients at home. Those are chronic disease patients or patients that are aged or patients that have had a surgery and can go home earlier, for instance, with a smart patch. We monitor them at home with several devices, and they can use an app in order to see their own parameters. They can look up their information, their own information, and they can chat with nurses, real nurses, not virtual nurses. And it has been quite a success until now because the healthcare insurance company that gives us a lot of budget in order to do this in a sustainable way. So that was very important that we got funded. The tech industry has co-created with our healthcare professionals and with the patients in order to make to make it work, also to make it integrate into the workflow of the healthcare professional, which is really important because it's not about the digital product or the device, it's about the integration in the workflow of the healthcare professional as well. And we have a continuous loop where we ask patients how they experience that home monitoring, and that actually it's a hospital at home model where Vic was talking about. It's not a complete disruption, but because it took us 3 years to come to those 10,000 patients, so it's not going very fast. It's going faster now because we've got volume, we've got experience now. So now you can see that we are accelerating the growth. But it's a really exciting. It's really exciting to see how it grows and how successful it is. And we have also evaluated scientifically, and we can see a lot of satisfaction with the patients. They're really happy because they stay independent, like you say. They can go by bus when they want to, and they do not have to go to the hospital. And also professionals, our healthcare professionals, are really happy about it. They have different conversations now with the patients, so it has been quite a success.
I think so. Co-creation is important.
Yes.
The reason why I started the PhD course this year is because I started the private sectors, but I have to learn more as academia. So it's important to gather the industry and academia and medical and many. So to for solving the problem, it's a co-creation is the best way to solve the solution. I learned from Cabby and Bakeries.
Yeah, big vote. So maybe Mel and Vic, sort of final comment in terms of things that you're excited about going forward about the future of aging care. Maybe just sort of one thing that's burning for you.
I'm optimistic. I do think that technology is going to get adopted. As I often meet with many other age tech entrepreneurs, and one of the things that we talk about is that this sector is the last frontier of technology. It truly is. It lags behind even hospitals in terms of technology adoption, and I think that there will be a day, and that day will happen soon, I think, where you will see a broader adoption. It's going to look different, I predict, than what it looks like in a younger demographic, but it's in many ways going to be better. It's going to have a better user interface, which will hopefully be even more minimalist than what we have today. And I think we're on the cusp of some very interesting times. I think we're going to be forced to see this adoption over the next few years due to the demographics, due to what's happening in the AI world. I think it's going to happen soon.
Okay. Last word, Mel.
I think to build on this, we're seeing baby boomers, my generation, moving into our senior years. We used to make fun of years ago that older adults may not have been as good of adopters of use of technology. And now you're seeing your baby boomers moving into their senior years. So you've got people who grew up a little bit more tech enabled. So you're going to see a lot of adopters of the biggest cohort of our population, our older adults, who are more technologically inclined, and the technology getting easier to use also, as you said, Vic, so that it becomes easier and easier. So you're going to see this huge cohort that needs the health help, that's more interested and willing to be proactive in preventive health, that's more interested to age at home in place and not have the need for long-term care and senior living, which doesn't exist for enough of the population today. So there's a whole bunch of things coming together, but it's use of technology, and I'm optimistic and excited about it. But I'd love to hear the closing words from the visionary Stephen Johnston. Tell us about what you think.
Thanks, Mel, for trying to turn the tables. But I just wanted to very quickly say, yes, the trends that we've identified, there's so much going on, it's so complex. The strands that are coming together around the business, emerging models, innovation, the technology and the user side need to be addressed in a systemic way. And I think that's what we're seeing. As we've seen models at a national level, we've seen models at a town and local level. And I think as we create those systemic approaches and co-creation collaboration that all of you have emphasized, keeping the perspectives of that end user, ideally humans, but occasionally also AI enabled, is going to be essential to how we get there. So yes, please welcome me in thanking our panel for an enjoyable discussion and looking forward to seeing what the future brings.
And please join me in thanking our moderator, Mr. Johnston. Thank you very much.